Good evening. The COVID-19 pandemic, it has been hard on everyone. It's also exposed health disparities in certain populations, including more than 4 million Americans who are blind or have lost vision. People with vision impairment have been having a challenging time, from completing home COVID tests to handling telehealth appointments to getting to the doctor. So, what are the resources that people with vision impairment need to live independently and maintain their quality of life? This is a question that extends beyond COVID, and it's the central question that we're going to address today. I'm Julia Rosedahl. I'm a glaucoma specialist at the Duke Eye Center, but I'm here today as a representative of the National Eye Institute. NEI's National Eye Health Education Program, or NEHEP, is working to educate health practitioners about vision rehabilitation to broaden the assistance available to people with vision impairment. We want them to be able to take advantage of assistive technologies and other tools to help with things like reading, getting to work, navigating around their neighborhoods, and setting up their homes to avoid falls and other accidents. We're calling this conversation Function at the Forefront, because a person's ability to function according to their needs is really the goal of any rehabilitation and the key to a good quality of life. Now I'd like to introduce our panelists. Dr. Mark Wilkinson, if you don't mind giving a wave, Mark, thank you. Dr. Wilkinson is a clinical professor of ophthalmology in the Department of Ophthalmology and Visual Sciences at the University of Iowa Carver College of Medicine. He's a member of the University of Iowa's Institute for Vision Research and the National Advanced Driving Simulator. He's a fellow of the American Academy of Optometry and chair of the Vision Rehabilitation Committee of the NEHEP Planning Group. Thanks for being here, Mark. Our next panelist is Omar Mohidin. He's an occupational therapist providing low vision rehabilitation services at the Duke Eye Center. In his current role, he sees clients with age-related acute onset vision impairment and addresses how changes in vision affect performance challenges in activities of daily living. For over the past 10 years, Omar has worked in both clinical and nonprofit eye care settings, as well as academia, doing research in the fields of preventive medicine, health disparities, and health communication. If you don't mind giving a wave to everyone on our stream, thanks, Omar. Our next panelist is Dr. Penny Rosenblum. She's the owner of the consulting company Vision for Independence, LLC. Penny has more than 35 years of experience as a researcher, university professor, and teacher of students with visual impairments. She was born with cataracts and nystagmus, and as an adult developed ocular hypertension. And I saw you give a wave before. Thanks so much. And our last but not least panelist that I'm going to introduce is Ed Haynes. He joins us from Hadley, which is a leader in low vision education, and he's been with them over 15 years, currently serving as the Chief Program Officer. Ed has enjoyed a 25-year career in the field of vision rehabilitation, working for both state and private agencies as an administrator, vocational rehabilitation counselor, and vision rehabilitation therapist. So I'm really excited to have all of you on our panel. I'm pleased to have this opportunity to talk with you. You each have such an important perspective to share. So thanks so much for being here. I want to start the conversation with you, Mark. NEI recently changed the name of the NEHEP Low Vision Program to Vision Rehabilitation. Why is this shift important, and why now?
Well, Julia, following discussions with our stakeholders, including the NEHAP partners, our planning committee members, as well as our low vision work group, it became clear that the use of the term low vision is outdated. In the past, the term low vision was associated with a reduction in central vision or central visual acuity. However, there are many people with normal or near normal visual acuity who have functional vision problems because of visual field loss or contrast loss. Often these individuals and their eye care providers recognized that they did not have traditional low vision, and as a result, they did not appreciate the need for vision rehabilitation services despite the functional problems they were experiencing. Because of the recognized need for a broader definition for the care of individuals with vision loss, NEI's NEHAP has changed the name and focus of our low vision subcommittee to the Vision Rehabilitation Subcommittee. The new Vision Rehabilitation program will take a solutions-oriented approach with the goal of educating people with all types of visual impairments about the resources available to help them live full, independent lives. It also empowers eye health professionals to share vision rehabilitation resources with their patients or refer them to specialists who can provide a rehabilitation model of care. It is important to know that rehabilitation care is provided by a variety of professionals, not just eye care providers. As you have heard already, representatives of some of these other care providers are with us today, including an educational professional and an occupational therapist.
Thanks, Mark. So who could benefit from vision rehabilitation services?
Well, vision rehabilitation services should be provided to any individual, regardless of their age or other handicapping conditions, who's having a functional problem because of a reduction of their central vision, peripheral vision, or because of contrast loss.
And Omar, when we say vision rehabilitation, what services are we talking about?
So it's a loaded question. There's a whole slew of people, but in defining kind of what vision rehab is, it's a host of services, and at the core of every service is to maximize a person's remaining functional vision or compensating in their vision loss in such a way to help them participate in daily life and improve their quality of life and well-being. So in terms of services, patients may see different specialists focused on different aspects of their daily life. And so these specialists may include ophthalmologists or optometrists who may diagnose and treat or discuss treatment options, make referrals to other specialists and state agencies. They may work with people like myself who are occupational therapists who do recommendations and training on assistive technologies, assess other comorbidities such as physical or cognitive limitations, and making modifications to the environment or activity to help participate in that. And of course, address anything in terms of falls prevention, chronic disease, and other comorbidity management. There's orientation mobility specialists who may teach someone to use tools or strategies to safely navigate an environment and participate and get around in their community, whether it's getting to work or school or to the grocery store. Mental health is a big part of vision rehab. And so there's social workers, counselors, and other mental health professionals that may help people deal with coping with vision loss if they're dealing with those difficulties. If they're school age, they may work with teachers for the visually impaired to help access learning. If they're working age, they may work with vocational rehabilitation counselors to assess job skills and discuss job training and placement. Vision rehabilitation therapists who may work on independent living skills. And I keep mentioning assistive technologies. There are actually assistive technology specialists and vendors who would then sell and dispense those devices. So I know that's a lot, and I'm sure I've left out a few people. So I may pass this over to Penny to fill in any blanks I may have.
Yeah, you started off by saying it was a loaded question, and so I'm excited to hear how Penny would define vision rehabilitation.
Well, from my point of view, I think about education for children. And I know, Omar, you mentioned the teacher of students with visual impairment and the orientation and mobility specialists. So orientation and mobility specialists really are trained to work with both children and adults in most programs. Some preparation programs, they might emphasize one, or, children, and another program may put more emphasis on adults. But with very young children, they're not going to be taking the bus or anything, but we need to help them learn to get around their house, their classroom, identify sounds and smells and what they can see visually if they have usable vision. Teachers of students with visual impairments work with children birth to 21 years of age. And within that group, there are some folks who are trained specifically in early intervention to work with our children birth to 3. So our students with visual impairments, their rehabilitation, so to speak, we use something called the Expanded Core Curriculum, or the ECC. And that's 9 areas. It includes some of the areas that you would think of, like the assistive technology and the sensory efficiency, which includes learning to use your vision and orientation and mobility, but other areas as well, career development, social skills, for example. self-determination, being able to make my own decisions. So from an education standpoint, that we don't typically use the term rehabilitation within the education setting. We're really focused on the same things as we are with adults. Let's help everybody be as independent as they can and maximize that vision that they have available to them with their other senses as well. So thank you.
Yeah. And Ed, from your perspective at Hadley, what are the services that you focus on?
Well, I think Omar and Penny were really comprehensive. I guess I would just add a few things. One is that it's important to understand that vision rehabilitation can take place in a number of different settings. So it can be virtual, it can be in a clinical setting, and it can be in someone's residence. So it's important to recognize that. And then also for older adults with age-related vision loss, vision rehabilitation sometimes really never ends, because vision loss is progressive. So it's not like when you break a leg, you have physical therapy, you learn how to regain function, and you move on with things. Every time your vision decreases as an older adult, you need perhaps a different set of services and adaptive training that you haven't had before. So it's an ongoing and sort of a lifelong journey, really.
I love how we've kind of talked a little bit about different ages and a little bit of different, types of things that cause vision loss. But Mark, would you describe for us different levels of vision impairment and what types of services that people at different levels might benefit from?
Well, you have a variety of different types of vision problems. Somebody can have central vision loss. And in every case, the first treatment is to make sure that they have the correct glasses. If they don't have the right glasses, we're starting at a deficit. So following that with central vision loss, we oftentimes are using optical magnification, which could be special glasses or magnifiers. For people with more severe central vision loss, electronic magnification can be helpful because it can make things both bigger and brighter and allow somebody to read at a more meaningful speed. Individuals with peripheral vision loss may need contrast enhancement, and so they may also benefit from electronic magnification, not so much to make things bigger, but to make them brighter. Oftentimes on devices now, we have the good fortune of being able to use dark mode, where we can do white letters on a black background on our computers, tablets, and smartphones, which can make things much easier for people to see. Individuals with vision loss oftentimes have mobility difficulties, and so we have to think about the use of a white cane, sometimes as an identification tool, but also for mobility assistance. And that training, as Omar and Penny said, comes from a certified orientation mobility specialist. So they have to get proper training for that. Some individuals are going to have all things. They're going to have maybe mild central vision loss, some peripheral loss, and reduced contrast. And they, like everyone, are going to benefit from task lighting, as everybody does, to help them function better. Electronic magnification may be needed, or the accessibility features on the devices that we all use every day, tablets and smartphones. So beyond vision enhancing options, additional professionals will be enlisted to help individuals who are visually impaired to function at their highest potential, whether it's in the classroom, the workplace, the community, or their homes.
Penny, it sounded like, or it looked like you had something you wanted to add.
I did. I think Mark did a wonderful job, but I did want to mention that some of our children, about really 56% in some research that I was recently involved with when I was director of research at the American Foundation for the Blind, families reported to us that 56% of the children had a visual impairment and additional disabilities. And the most common additional disability, or the most common eye condition we're seeing in children, especially our children with additional disabilities, is cortical visual impairment. And those children present a little bit differently and grow up to be adults who present a little bit differently, in the sense that the structure of their eye is intact, but the processing, getting that information to the brain and having the brain interpret and understand, there's a breakdown there. So sometimes these children's vision can really fluctuate. The child might see a marble on the floor, but not see mom standing in front of them. And so these children can be really challenging when we think about it from an educational standpoint, in trying to figure out the best programming for them to help them maximize that usable vision, because their vision is going to fluctuate. And for many of those children, over time, their use of vision improves through very systematic instruction. And some of the principles I'm talking about also apply to people who have a traumatic brain injury. For example, somebody who is shot, has a gunshot wound or is a near drowning victim. So it's, it can very much vary individual to individual, and not just be central or field loss or contrast, but a little bit more complex. Thank you.
I love that you brought up kind of comorbidities. That's an issue in older patients as well, especially cognitive decline with their vision impairment. Ed, you had indicated to weigh in on this.
Sure. There's another factor particularly with older adults, and that's resiliency. I'm often amazed at how different and individualized the experience of vision loss is with older adults. And I'll work with someone with 2400 and they seem to be coping fairly well. And then someone with maybe 2200 acuity or 2100 is really struggling. So I think, additionally, you have to consider the emotional state of the client and their level of resiliency. The efficacy of services really has to take that into account. So thanks.
Yeah, that journey is so individual. And I think one of the things that Omar mentioned during his wonderful review of vision rehabilitation services is mental health involvement in the team as well. Penny, what have your patients or what resources do you find most helpful?
When I think about children with visual impairments, there's a couple places that I always suggest that family members and teachers check out on the internet. So one of those is a website called Family Connect that is run by the American Printing House for the Blind. There's also Career Connect, so helping people with vision loss get back into the career field if they've been out for a while, or initially get into the career field. It started out being more for younger people, but resources for other folks of different age levels who are wanting to really look at career issues. The Texas School for the Blind and Visually Impaired has a phenomenal website. And then they are partners with Perkins School for the Blind in two websites. One is called Paths to Literacy, and the other one is called Paths to Technology. So those are some of the resources I always connect people to. I really, talking from my own personal experience as somebody with a visual impairment and from my professional experience, I think there's so much to be said for role models and connecting people with other people who are having similar life experiences, so that whether that's somebody who's older and is experiencing macular degeneration, connecting them with somebody else who has macular degeneration, in that same age group potentially. So, or it could be a family member of a 1-year-old who's just been diagnosed with albinism, and connecting them with some folks who have albinism of different ages so they can see that progression. So I really encourage educators, rehabilitation providers, healthcare providers to think about how can I connect children, adults, families with others who they can share experiences and learn from. Thank you.
Before I let you go and ask Ed that same question I asked you, I wanted to find out from you what the referral process looks like for children. It's something that came up in an earlier discussion with you when we were prepping for this, and I really want to make sure I had a chance to have you share that. And I'm apologizing for kind of going a little bit out of order from our plan.
That's okay. Plans are just a roadmap and we all detour. So thank you very much, Julia. So if we have a child, and I'm talking about somebody birth to 21 years of age, who's in the high school type, K-12 education system, not a college student, or somebody who's graduated from high school. But if the child is from birth to 3 years of age, the school district will have something called Child Find. So the family or the eye care provider can connect that family with Child Find, and there'll be a series of folks who will do assessments. And if a vision impairment is part of the child's needs, then a teacher of visually impaired students will be involved. If there's some physical stuff going on, an occupational or physical therapist might be involved in that assessment. And the team will come together, review results, and work with the family to develop something called an individualized family service plan, or an IFSP, to help that family grow as a family, supporting that child's needs until the child turns 3. When the child turns 3, it's a magical kind of, one day you're not 3 and the next day you're 3, and then you're what we call school age services. And so within school age services, if the child's not already receiving early intervention, I always encourage families to contact the special education office or the exceptional student office, depending on what it's called in their district, to make sure that they explain that their child has a visual impairment, and to ask about the referral process. The law that governs both the early intervention and school age services is called the Individuals with Disability Education Act, or IDEA, or IDEA. So you'll hear it called all three. But the IDEA really very specifically lays out the process for assessment, not medical assessment, but educational assessment. And the team will then meet and develop an individualized education program, or an IEP, for that child, to have specific goals over a year period that the team members will help that child reach. So the bottom line is, very first step, reach out to your local school district. Make sure you have your child's ophthalmological reports and any other medical reports on hand. Don't give up. Advocate. And if you're having trouble making that proper connection in your state, then I really encourage you to reach out if you have a Commission for the Blind or the Department of Health and Education Services in your state, and say, hey, I'm not getting anywhere with the school district. How do I move forward so my child gets services? Thank you.
Thank you so much. I want to discuss just real quick, the process for adults. And Mark, I know that you're very skilled in this area. I have it easy here at Duke. I just refer to our amazing vision rehabilitation service here, and I know that's what your patients there in Iowa have. But how would this process be for grown-ups?
I think what Penny commented about is the correct thing. What you want to do first is talk to your eye care provider and ask for referrals, so that they should know who the resources are in their area or their state. But if you're not getting anywhere with that, then the state has a department of rehab or a department for the blind, and they would be the contact folks to find what the resources are in the state to start getting some service. Obviously, if you're a veteran, then they have a whole separate system in the VA to take care of people who have vision problems.
Thank you. And sorry to skip around a little bit, but I'm got my sights on Ed, because I'd really love for you to answer that question too. I want to hear from everybody. Penny, thank you for starting us off. But Ed, what resources have you seen kind of most used at Hadley, or you think are kind of the most helpful?
Well, I'll give a plug for Hadley itself right away. I think we're a great resource. Where one of our benefits is that you can get a referral. I've worked for state agencies. I worked for a lot of organizations. You can get a referral, but a lot of organizations have, particularly for adults, they have criteria for eligibility. That may be an acuity level. That may be a whole lot of things. I have horrible memories of sitting in an office, having someone come in and they want services, and I have to tell them, you're not visually impaired enough to get services. Come back later. So the benefit of Hadley is that 5 minutes after getting home from the doctor's office, receiving a diagnosis, they can be talking with a vision professional, or participating in a virtual workshop, or signing up for a community of discussion groups. We have a lot going on. So there's my little plug for Hadley. But that being said, there are, in-person learning is also really critical. So it's sometimes not easy to find the resources in your community, particularly people who live in rural areas, or depends on the state. Some states have very strong vision programs and agencies for the blind and visually impaired. Other states do not. So the visionaware.org website has a database of all of those, entities separated by state and kind of service. So that's where I'd look first. Although I will say you can call Hadley and we'll help you find what you need to. And then just a plug for the National Library Service, the Library of Congress, for older adults who just, if you want to give them that small success right away, right? Something they can do that they haven't been able to do in a while, read a book, get them signed up for that. It's free. It's terrific. It comes right to their house. So I'll stop there. There's a lot of resources, but those are where I'd go first.
And I have to second the hadley.edu website. It's really fantastic. Lots of things to learn there, even if you don't have visual impairment. I feel like you've got some great workshops there. Omar, I feel like I know what you're going to say, but I wonder what resource do you find really most helpful? And then I'll see if I've guessed right, if I know you well enough.
Curious. Well, I third the notion about Hadley. So we overload our patients with information because we're teaching them so many different ways. So Hadley's a great way of having follow-up. So if they have access to a computer or telephone to kind of self-pace and educate themselves. Certainly everyone's mentioned state social services that fall underneath the Department of Health and Human Services. So whatever that may be called in your local state. If someone's a veteran, we'd certainly want to get them plugged into the VA's own kind of medical system. And what they call the blind rehab outpatient clinics, if that's available. But in terms of other services, we like our local support groups, our local nonprofits, just because it's a sense of community and belonging, and just finding your people.
Well, I was wrong. I thought you were going to say lighting.
Lighting is so important. Yeah, I probably spend at least 20 minutes with every patient just going over what is proper lighting. So the light bulb section of Lowe's and Home Depot.
Mark, how about you? What resources that maybe haven't been covered yet do you want to make sure that we highlight?
I think we've covered them pretty well. I mean, my patients have really enjoyed Hadley. I think the problem with support groups, they're wonderful, but they're not really readily available to the vast majority of people who are visually impaired. And so transportation is a problem, timing is a problem. So being able to have a resource online that they can go to that's constantly updating, that has great videos. I've been very impressed and very happy with the resources that are available through Hadley.
Great. So all the folks on our streams are getting some good places to go and check things out. Speaking of kind of screens and online, at the top of the program I mentioned COVID, which of course really has taken over our whole lives, but definitely impacting our folks that are visually impaired. And in this virtual environment, and this question I'm pointing to Penny and then Ed, how has the demand for vision rehabilitation been impacted by COVID? And I'd love it, Penny, if you could kind of take this one first.
Sure. I was director of research at the American Foundation for the Blind from 2020 to most of 2021. And we did 3 studies in the time I was there. The first one was called Flattening Accessibility, where we examined the impact of COVID-19 on 1,921 adults very early in the pandemic in April of 2020. And then we did 2 studies called Access and Engagement with family members of children receiving education services, teachers of visually impaired children, and orientation mobility specialists. And we had 1,432 people in spring of 2020 respond and 662 in fall of 2020 respond. Bottom line, COVID, whether we're talking about children or we're talking about adults, has really brought to the forefront access technology issues. And whether we're talking about a child who's, can't get stuff out of Google Classroom, the teacher's making videos, and posting them for the kids to watch and they're not accessible. Whether we're talking about a college student who was taking a lab and now instead the instructor is, telling people to watch these videos of the lab, for science, or we're talking about an adult who needs to order groceries or check their prescription. We in the field, we who live with visual impairments like myself have known about these access issues for many, many, many years, but they really have come to the forefront to really make other people aware. Recently, there was a New York Times article about COVID-19 home tests not being accessible. I mean, come on. We, talk about all the infographics that have been up on the news for over 2 years of, how many people in your state have been diagnosed in the last week. So that technology is a big issue. Transportation is the second big issue. Well, there was three really in our flattening accessibility. So technology, transportation, because so many buses and trains and stuff either stopped or went to very reduced schedules. People didn't want to be on those because they couldn't tell if they were 6 feet away from somebody and whether people were wearing masks, those types of issues. And then healthcare. I'm sure most of us have now had a telehealth visit in our life in the last 2 years, and many of those apps are not accessible. Or even if the app itself is accessible, my shoulder hurts. Now I've got to be ready for the 5 minutes when the doctor's actually going to get on with me and have that camera pointed towards my shoulder. Well, if I can't see very well what I'm pointing to, then the doctor's, not going to be able to do their job. I mean, even right now, to come into this Zoom meeting today as a person with a visual impairment, I had to say to my colleagues who I know all understood, don't put something in the chat that you want me to respond to. Here's my cell number. It's on mute, so I can look at large print. So that's an issue. And what are the shortcut keys so that I can turn my microphone on and off without having to lean over my laptop and look for where my cursor is? So a lot of this stuff has really come to the forefront. Thank you. I know I talked for a long time, but it's such a topic I'm passionate about.
It is really so important. And I appreciate you taking the time to really provide those examples. I think that is so helpful to really, for a moment at least, kind of put your foot in someone else's shoes, because that is really, really quite difficult. Ed, right before the pandemic, it seems like maybe a year or so is when you guys launched your fantastic new website, kind of just in time. But being such a great virtual resource, I wonder, what have you seen over these last couple of years?
Sure. When we did launch, we were pretty much the only virtual game in town. But when a lot of agencies had a lot of employees that couldn't meet in person with folks, people started to produce their own virtual content, which is great. There's just a wider variety out there. Now, people have gone back, I think, hopefully, when it's as it's become more safe, to doing in-person intervention. But what we have noticed is that, on a positive note, is that the support groups that Dr. Wilkinson were saying are kind of few and far between, and Omar was saying are so important, those groups went virtual, and they've stayed virtual. And in fact, they're a little more accessible now than they were before, because we're all more comfortable using Zoom. Our family members are comfortable using Zoom. It's not perfect. It's not the access technology is not always accessible, but it's sometimes more accessible than trying to find a ride to a support group. So we found that older adults particularly are connecting maybe even more virtually than they were able to do in person before. So that's a positive outcome.
I have a couple more questions, and then I think that we've got some questions coming in for the live stream. But first, from Omar and Mark, tips for health care practitioners. For hopefully we've got some primary care doctors out there, some folks that are not eye care professionals that take care of patients. What tips do you have for them for how to talk to patients and their loved ones about vision rehabilitation? Maybe Mark, would you take this one first?
I think that primary care providers need to understand that many people who have vision problems are depressed, and so we need to be aware of depression as a huge problem. And if depression isn't really properly addressed, then trying to do rehabilitation is going to be more difficult. So the person has to accept their situation, understand that they've got to move forward. And it's very hard if you're losing your driving privileges or you're not able to read the newspaper as you did before. You have to be able to accept where you're at to be able to move forward with a rehabilitation strategy to help you function better. So I think being sensitive to the fact that their patients may have vision problems, asking them those questions. Are they having difficulty, doing daily living activities? And as a result of that, are they feeling more down and depressed and incapable of doing things? That's really the starting point. And then knowing that there are resources out there that can help their patients function better. They just need to get them plugged into the system.
Great. Omar.
Yeah, very close along those same lines. Vision loss can be such a scary, anxiety-provoking thing that they often go to their providers and all they hear is bad news. I would suggest, try to be more positive, get them to be aware that there are resources and tools out there and that services like what we have to offer exist, and get them prepared to participate in vision rehabilitation with kind of open eyes and just a better positive outlook. So I would say stay positive and kind of let that shine through in the conversations that you have with your clients.
Thank you. And Penny.
Just a real quick one. Please really think about when you use the term legal blindness and how you use the term, because I have talked to so many people, whether it's the person who has the vision loss or the family member of the child or adult, who hear from the professional in the 30 seconds they're in the room, well, I can't do anything for you, you're legally blind, and they walk out. And no connection with services, no really explanation of what legal blindness means. Often the person has driven themselves there. And so I know at some point we have to bring that term into the discussion, but it needs to be down the line and not in the beginning, because it just is so confusing. And again, if we have depression and anxiety and now we're telling you you're blind but you can see, it just doesn't make sense to you. So really think about the terms you use, and please be prepared with a resource list in accessible format, that you're connecting people. Even if you can't do anything medically, there are other people, as you've heard today, who can support that person. Thank you.
Great. I'm so glad you brought up that kind of legal blindness and how important language is. So we've got some questions from our live stream. And this first one, I'd like to really have Ed take a stab at it first. And it really follows up nicely, Penny, with what you just mentioned. So Ed, how can people who have not been referred for vision rehabilitation get help? And this is from Facebook. And so I'm imagining, someone who calls into the Hadley, they find Hadley and they haven't been referred, but they're on the phone with one of your experts. Where do you send them?
So we at Hadley we'll try to evaluate what their individual condition is and what their circumstances are and what it is they need, and then make an appropriate referral to their local agency if one exists. A lot of the problem is that there are a lot of places local agencies they're not there for folks. It's a big problem. So, I have worked with many clients that have spent years not knowing about any services at all. And they've just, after a while, they've done some of their own homework. Maybe they've gone through that adjustment process that Omar was talking about, and they've come out on the other side. They're looking for solutions, and they finally find something. What would be wonderful is that we have an established protocol for every patient. So just like when you break a hip, every doctor knows exactly what to do and where to send them and what to do next that's available locally. And unfortunately, we don't seem to have that system in place for older adults, particularly with vision impairments.
And I think I can guess how Mark would answer that question. I think he would say, talk to your eye doctor and ask them for a referral. Did I guess right on you, even though I missed the mark on Omar earlier with the lighting?
Absolutely. You got to ask your eye care provider. I mean, everybody who's got a vision problem should be seeing their eye care provider to make sure that things aren't getting worse, that there aren't other comorbidity problems that are making things worse, and say, hey, I'm having trouble. I need help. Who would you refer me to? And so that's really the starting point. Because you want to make sure you're getting the eye health ongoing that you need, your eye health assessments, but ask for help from your eye care provider. Who can you refer me to?
And the other question that we've got from Facebook is, I think I'd love to hear Omar's answer and then Penny. So the question is, what resources can help people with vision impairment with their career? And I'm thinking that you must have encountered this question in your time taking care of people with vision impairment in the vision rehabilitation clinic. Omar, what do you have for career?
Certainly. So if they're employed, let's keep them employed. So first thing we'll do is we'll always do as an occupational therapist is do like kind of an activity assessment or and just make sure that they're suited for their line of work. And if they need accommodations, write them an accommodations letter so they can keep in their position. If they feel like they do not have adequate vision to stay in their current job or they think it's a safety issue, then we'll certainly refer them to state social services to get plugged into vocational rehabilitation services so they can explore those options with a counselor.
Great. Penny?
I had mentioned the Career Connect website, which is housed at the American Printing House for the Blind. And you can get on there, and if you have a career that you're in or you're interested in, you can find people with visual impairments who have that career or a similar career and connect with them. As Omar said, each state has a vocational rehabilitation services. Like in Arizona, it's called Rehab Services Administration. So it's going to have a different name in a different place. But those are folks who can help you get training so that you can get back into the workforce. I think it's really important to connect with other local resources that somebody who, let's say, lost their job, like a one-stop, to find out what services are available. For example, resume writing. You might be using Zoom text when you write your resume, and somebody else may not be using that accommodation, but you still need to learn those resume writing skills. I'll just mention that there's a report available on the American Foundation for the Blind website called Workplace Technology Study. It was a study that I and my colleagues did where we examined how people who are visually impaired are managing in the workplace. And technology, again, was a really key piece of how to make it work and being able to explain your needs to others. What accommodations do you need? And then being able to negotiate. Okay, I can't go drive the route to, pick up our bank deposits on Fridays anymore. But if I can swap that responsibility with this person who can do the driving, well, I can do more of the data entry piece. So how can you stay employed with working with your employer and your colleagues to rework some of your responsibilities that may visually be difficult or impossible for you to do at that point?
Yeah. So we have actually gone over, and it's my fault as the moderator, but I really enjoyed our conversation so much. I want us to really leave something practical and actionable with anyone who's watching us, but we have negative time. So be as quick as you can, but I'd like to do a quick round robin with one thing that healthcare providers can do tomorrow to ensure people with vision impairment can get the care they need. So I'm going to ask Omar unmuted. So Omar, go for it.
I would just say that it's never too late and it's never too early to refer to vision rehabilitation services. So the minute you hear your patients have a functional complaint, like I cannot read, write, drive, see the food on my plate, make that referral.
Great. Mark, I saw you had unmuted earlier, so you're ready.
Yep, I would just say, there's help out there. So recognize that there is help and seek it out for your patients.
Thank you. Penny.
Be holistic. I know it's your job to focus on the medical aspect of that individual's life, but think about their other aspects. And the thing I always say is, if this was your mother or father or child in your office, what information would you want them to have? And get to know your teachers and students with visual impairments, your O&M specialists, your rehab folks in the community. So you can be the person doing the referral. Thank you.
Thank you. And Ed.
I'll just echo what everybody said. Make sure people know there are services, and if possible, refer them to a service that's going to give them an immediate result. People are traumatized when they receive that diagnosis. They don't want to go down a long trail of wait lists and all sorts of other stuff. They want some help right away. If they can have that immediate success, they'll build resilience and look for other solutions.
Wonderful. Thank you all so much for such a wonderful conversation. It's been such an honor to get to talk with 4 experts like you, and hopefully share some really great information with folks out there in virtual land. Really appreciate the opportunity to have you on the call, and thank you to the NEI folks for this opportunity. All right, good night, everyone.